much. Other states are worried about the coronavirus straining their hospital systems. More than 8,000 people in Florida alone are now hospitalized with the virus. And our lead national correspondent, David Begnaud, is following all this from Tampa for us. David, good morning. What, if anything, are Florida hospitals doing to treat more patients?
So, look, the governor has said it's not an issue of having enough hospital beds. It's a matter of having enough people to treat the patients. So we just found out that the governor has secured 3,000 nurses from elsewhere, other states, to come here to Florida. About 100, we're told, are coming to Tampa. We came to Tampa because this is the largest hospital in this area. We wanted to check on how things were going. And we spoke to one of the leaders in the emergency department who said, listen, we have 7 ICU beds available. It doesn't sound good, but we're doing everything we can to ride that wave right now and not get overwhelmed by the patients who keep coming in day after day.
If you have wave after wave after wave, how long can you sustain that?
That is Dr. Jason Wilson. He's the Associate Director of Emergency Management at Tampa General Hospital. He says the volume of COVID patients coming to the hospital is 5 times higher than it was a month and a half ago.
We've really done everything we can to try to keep patients out of the hospital when they don't need to be in the hospital.
The situation is far more dire in South Florida. There are now just 10 ICU beds left in all of Miami-Dade County, the most populated county in the state.
Miami is now the epicenter of the pandemic. What we were seeing in Wuhan 6 months ago, 5 months ago, now we are there.
Dr. Lillian Abu is Chief of Infection Prevention for Jackson Health System. She says doctors and nurses in her hospitals are working around the clock due to the sheer volume of patients, and some of them are getting sick.
A nursing shortage that is about to enter our community, no one's ready for it, because on a normal basis without coronavirus, there's already a nursing shortage.
That's Melissa. She's a nurse from Florida who went to New York City at the height of that city's outbreak. She says she's petrified, with crises in several states now, that there won't be enough nurses like her to come down to Florida to help.
Right now, Texas is sucking in all ICU ER nurses. They're getting all the specialty nurses. Arizona is getting the leftovers of that. So what does Florida get? That's what's really scary about this.
In addition to a need for more testing, there is an extraordinary need, we're told, for convalescent plasma. The convalescent plasma comes from people who survived the coronavirus and have the antibodies in their blood. We heard from OneBlood, second largest blood bank in the country, the largest in the state of Florida. And right now what they said is doctors are using convalescent plasma earlier on in the treatment process because it's proving to be more beneficial. They're not just using it on the sickest patients. So there's more of a need because there are more patients. So if you have recovered, you can donate every 28 days, and they desperately need that plasma from you. Anthony?
Everything helps, David. Thank